Hey guys, so I'm at Vera Clinic at the moment and I had the opportunity to speak to one of the doctors and basically ask him all the questions that you guys have asked me in my comments on YouTube. So I've gathered as much as I can and this video is really for you guys. So hopefully it answers all the questions you guys have. So I'm here today with Dr. Kerim. He is the doctor that I had a consultation with the first and second time when I came to Vera Clinic. We just had a consultation with our friend Kinjal. You explained everything very well and we're very thankful to have you as our doctor. So today we are going to go through a couple of questions that you guys have had. I posted on YouTube a couple of days ago and a lot of people have responded and asking for some decent questions. So they want to know a lot about Vera Clinic. Let's first start out with what is the single best thing to do after a hair transplant to keep the existing non-transplanted hairs from falling out?
So after the surgeries, yes, most of the patients, they suffer from the genetic hair loss. And most of the time, as it is something genetic, even after the transplant, the hair loss might continue. The transplant hairs, they will stay there permanently because we are extracting them from an area resistant to genetic hair loss. But your original hairs, those hairs might keep falling again, and we can prevent this with a few options. So finasteride is a very popular medication. It's the only FDA-approved medication for genetic hair loss. That's why I think patients might want to consider it as a first option. There are both oral tablets and the topical formulations of finasteride. Probably patients are aware of the possible side effects of the oral tablets because when you do your search in the internet, you come across a lot of negative comments about it. We also don't advise the oral tablets for a few years now. We have switched to topical formulation of finasteride because it provides almost the same benefits without causing side effects.
That's actually very interesting because I have been taking oral finasteride for the past 2 years since the hair transplant. The only difference is that I take a little less now versus I used to take, I think, 1 milligram. Now I take 0.5. I feel like I still have a good amount of hair and it's pretty stable. But it's good to know that at least a lot of people are moving away from oral finasteride and moving towards topical, mainly because I assume lesser side effects.
Yes. The second option could be PRP treatments and maybe stem cell treatments for the existing hair. The studies, were done about PRP and stem cell treatment, but a patient needs to get 6 or 7 sessions of PRP in 1 year if they want to see improvement. That's what studies and researchers said. So as long as they can get 6 or 7 sessions of PRP in 1 year, it would be definitely helpful. The stem cells, once injected, they would also improve the existing hair. And the third option, as we mentioned before, would be finasteride. I think these three are the most important, supportive treatment technique.
Now, we spoke about what's the best thing to do after their hair transplant. Some people want to know what can you do prior to the hair transplant to optimize the chances of success.
So when it comes to success of the operation, of course, there are, a few factors. The patient's overall health is very important, and it's important whether they have any, chronic diseases, any atherosclerotic diseases or not. Because once those grafts are implanted, they need nourishment, they need good circulation, they need to reach the needed nourishment and the oxygen. So if the patients don't have any chronic diseases, if the patients are young, the circulation would be good. Even without supplements, the patients can get very good results. If the patient has a high cholesterol or if they are suffering from other atherosclerotic diseases, then they may want to focus on those treatments first because we also want to improve the circulation here.
Speaking of things to be on before the hair transplant, is it advisable to still be on finasteride or minoxidil for that matter, or should patients stop using it prior to getting it done?
So if they are considering a hair transplant, they may want to stop the finasteride a few months prior to the operation because with that way we can see the real hair loss pattern and the real situation and we can address those areas better. It's not mandatory, but if they keep taking finasteride, then they should keep taking finasteride because we will be planning the operation based on the existing density. When it comes to minoxidil, we advise stopping minoxidil a week prior to the operation at least because it increases the bleeding. After the surgery, once the scalp is fully healed, after 2 weeks or so, minoxidil can be started again.
Speaking of minoxidil, at least when I came down last time, I was told not to put minoxidil on the transplanted areas, on the recipient areas, but instead to apply it on my donor area. I believe this was because to help blood circulation regardless and not affecting the transplanted areas.
Yes.
Can you maybe explain why that is? Because a lot of people are confused about when they should start minoxidil and where they should apply it.
Minoxidil, it's proven to be efficient for hair loss, but it does not specifically target the underlying hair loss mechanism. What it does, it dilates the blood vessels, it improves the circulation, and it stimulates very, very small, teeny tiny hair growth. The patients, they must use this regularly, because if they, stop this medication, the blood vessels would shrink again and they might see a dramatic hair loss. That's true for the top of the scalp.
Yeah.
The hairs on the donor region, they are stronger and they are resistant to hair loss. But if it is applied on the donor region after the surgery, it would, accelerate the healing process because it will improve the circulation. The hair growth also on the donor region, it's not even at first.
Yeah.
Because we are extracting a lot of grafts, we are affecting the scalp, the circulation. So it would definitely help with the circulation and overall recovery of the donor.
A lot of people also want to know, when can you actually go get a haircut or trim that area after the hair transplant?
So technically, after 2 weeks, patients can get haircut as long as their scalp is not sensitive. Because if it's sensitive, of course, they should be postponing it maybe a week later or 2 weeks later. But technically, once the scars are fully healed, which takes 10 to 14 days on the skin, after that point, patients can, get haircut safely. They can use either trimmer or scissor, but they should definitely avoid the razor.
Yeah, no razor.
It would cause ingrown hairs.
That would be painful. Yes. Oh God. Another question was sleeping. We all know how terrible sleeping is after a hair transplant. A lot of people ask, why do we need to sit upright to sleep?
It's because during the surgery, in order to work on the scalp better, we need to, inject some fluids under the scalp. And eventually those fluids, they need to leave the patient's body. And it will happen with the help of the gravity. If the patient lay horizontally on the bed, like as if they are sleeping regularly, then that fluid, it would collect around the eyes, around the nose, it would cause huge swelling on the face. But if they achieve an upright position, maybe 40-45 degrees would be enough. That injected fluid, it will leave the body through the nape of the neck rather than the face. So that's happens with the help of gravity. And maintaining this kind of position for the first 3 to 4 days is important so that we can avoid the swelling. The patients, they are also using black band for 3 to 4 days to prevent the swelling. When they're sleeping, they will pull it down to their neck. They don't have to use it, but when they wake up, they will pull it up again.
Another very hot topic question was about shedding. Now, shedding is part of the process. We have to go through it, but a lot of people always get worried that a lot of shedding happens on their scalp, but also on the donor area. And, naturally you get worried. What can you say to maybe help ease that for them?
So I would say definitely this is a part of the hair transplant process. Because when we extract those grafts, they spend some time outside the body. And this is itself, it's a trauma to those grafts. That's why we make sure that we are separating those grafts, we are placing them in the fridge so we can slow down this process. And we always implant the grafts in the same order that we extract them. All the grafts will wait for the same time, not longer than this. As they were traumatized before, yes, first they will keep growing, but it's expected for them to shed. Around 95% of the patients, they go through this shedding phase. 5%, I don't know if they are lucky, 5% or not, but they do not go through the shedding phase. But this is pretty expected, and it's the nature of this surgery. Here, it's because of the graft spending time outside the body. But on the donor region, it's due to us extracting grafts. We are affecting the circulation a bit. That's why the donor recovery, we usually say it takes around 6 months. First one, the sides might grow earlier. At first, the growth might be uneven. But by the time passes, it should recover fully. And minoxidil also, it would help with this process.
Yeah, and that's why we end up putting minoxidil on our donor areas as well, to help hopefully get some sort of regrowth from that. Does the oxygen supplementation, how well do they work? And do you also have to do follow-up sessions, or is it kind of like PRP, you have to do it over a certain time?
The hyperbaric chamber treatment, the Oxycure session, we mainly advise it for the faster recovery and reduced inflammation. Because once those grafts are implanted, yes, they will need nourishment, they will need oxygen. And the first 24 hours, it is vital. It's the time period when those grafts reach the circulation. So that's why we advise our patients Oxycure sessions after the surgery, so we can reduce the inflammation and accelerate the recovery process.
Yeah.
Usually our patients can get 1 or 2 sessions a year. It's not mandatory to keep getting these sessions, but definitely it's proving to be efficient when it comes to reducing the inflammation and accelerating the recovery.
Are there any unique features at Vera Clinic specifically when performing a hair transplant that make it different against other clinics in Turkey?
I would say a comprehensive examination and a consultation. Because you're familiar, there are a lot of hair transplant clinics in Turkey, in Istanbul, and it's hard to know which ones are good, which ones are bad. That's why we always, advise our patients to have at least a few consultations so they can see which clinic is better, which clinic is not. So they can, compare. The patients also should be careful. They should avoid the clinics that says yes to everything. Here at Vera Clinic, we always perform, extensive examination, and we first understand our patients' expectations. This is why our patients here, they want to be happy, they want to gain confidence, and it's our duty to make them happy. And once they see a good clinic like Vera Clinic, they will see a good examination, a good understanding of their expectations, and the operation plan also, should be designed together. Because some clinics, they work like a factory, like they draw the hairline, they do the same design, same things all the time.
Yeah.
But here, each patient is unique, the design is unique, the plan also. We base that plan according to the patient's situation. So I think once our patients come here, once they go through this process, the consultation, the examination, I think they would feel safe in our hands.
I think that's spot on, because speaking about my past experiences, it's been good that I got the chance to speak to you initially. You made me understand a lot about my own hair transplant and getting the expectations right. You told me straight up that it's not going to be as dense as I would have liked it, but you'll get coverage there.
Yes.
And that eventually has happened for me, and I can't complain. A lot of people still say you should go back for another third hair transplant, but honestly, I'm pretty happy, but it's also because I've kept my expectations at a reasonable amount. Well, I think that is all the questions we've had for today. If anyone else has more questions, comment on this video and we'll try to hopefully get those answers in the near future. But I want to give a big thank you to Dr. Kerim. He has been very knowledgeable in all of his expertise in taking care of patients here at Vera Clinic. And I just wanted to thank you again, and thank you to everybody else who's put down questions. It's been great. Thank you so much. Appreciate it.